I'm going to begin by discussing the opioid bill. Now, if there ever was an issue that ought to be unifying in the Congress, that ought to bring Democrats and Republicans together to surmount an important challenge, it ought to be opioid addiction in America. This is a crisis indiscriminate of geography and politics. The reality is, opioid addiction is ripping through our communities like wildfire. A recent editorial in one of my home state newspapers captured the urgency, the extreme urgency of the opioid struggle with the addiction, and I quote, "Opioids are winning." After months of work, the Senate and the House has come up with an opioid bill. I can give my assessment in a sentence. It is a half measure. The job is far from complete, and certainly nobody ought to be taking victory laps. The reality is this opioid bill leaves on the negotiating table many opportunities to fight and successfully win the battle against opioid addiction. Now, a landmark study dealing with opioids came out a few months ago and found that 80% of those who are addicted to painkillers or heroin aren't getting treatment. I want everybody to understand, Mr. President, under this bill, those waiting lines are not going to get much shorter. The thousands of babies born each year with an addiction to narcotics. This bill won't be enough to bring that number down to zero, where everybody knows it ought to be, where there's a moral imperative for actually getting to zero. That's why you're seeing those headlines, opioids winning the war. Now, the package before the Senate certainly has the kernels of a meaningful game plan. But in my view, there's just not enough there. There are programs that are being established that could be a big help to those who are struggling to get their lives back on track, but there aren't the tools to deliver on the promise. Senators should know that doing only half the job now means that members are going to be leading with their chins when the appropriations process returns later this year. The reason I say that is here are some of the programs that are going to be bumping up against the uncertainty of the appropriations process. There's a program for pregnant women and new mothers suffering from an opioid use disorder. There's a program to help states take important strides when it comes to monitoring prescription drugs. There's better tracking within the VA. There's a plan to strengthen the networks of support in American communities that are best equipped to reach out to those who need support in fighting addiction, physicians and employers in the criminal justice system, and more. The bill greenlights the National Institutes of Health, putting new energy into the development of safe, non-addictive, affordable drugs and treatments for chronic pain. And the bill establishes a task force and grants for states to construct what I believe could really be a fresh approach to management and opioids, education programs, treatment programs, recovery programs, monitoring, ways to prevent overdoses. Getting those proposals off the ground, but with the Senate on its way out the door, it seems to me that you also have to do more than just leaving the strategy for actually winning against opioid addiction to the uncertainty of the appropriations process in the fall. Now, there are other questions with this bill. I'm very concerned about the provision that gives $75 million in kickbacks to the manufacturers of opioids that are considered, under the bill, abuse deterrents. I believe it's wrong for the bill, which does only half the job for Americans struggling with addiction, to then turn around and give an unjustified windfall to big drug companies. I offered an amendment to get rid of the windfall, and it was real simple, Mr. President. I said, let's get that money to pregnant women who are enrolled in Medicaid, women of limited means who are struggling to fight addiction, but the choice was made to give the windfall to the drug companies rather than to help those vulnerable women trying to get their lives back on track. So, example one, no funding for programs that really help women and others who are trying to overcome addiction, but give a $75 million windfall to drug companies. That, in my view, is an imbalance that does not pass the smell test. So the bottom line on opioid legislation is there's an awful lot of heavy lifting to do before anybody ought to think about taking a victory lap. In my state, and it pains me to say this, we're fourth worst in the country for abuse of opioids. So I hear from Oregonians who go from pills to heroin to tragic endings. I hear about accounts that nobody could have ever dreamed of, I was blessed to be able to go to school on a basketball scholarship. Nobody talked about basketball players who had an injury getting hooked to opioids and having tragic, premature endings and opportunities, choked off. We didn't hear those stories. You hear them now. And I've heard from doctors and pharmacists about the dangers the drugs pose and the difficulty of treating pain safely. And you hear from community leaders who are trying fresh approaches to reach out to young people. And my sense is every single member of the Senate is hearing these kinds of stories. So I want it understood that the opioid addiction crisis is going to keep raging unabated. Lives are going to continue to be lost, and families are going to continue to be torn apart until the Senate finishes the rest of the job. The rest of the job is still ahead.